I hope everybody enjoyed the workshops and got something out of them and were able to input. The next session is Professor Becky Tunstall from York University, who I'll let Becky explain who she is and what she's going to do. Thank you.
Thank you. I'm going to use this back.
There you go.
Brilliant, thank you.
Got the right way around.
Well, thanks very much for having me, everybody. You've had a busy day, and I'm really glad to see you've had so much fun in the workshop. Very glad to get you back. So I'm going to have to try and compete with the fun chat and the value discussion and any of you. So I'm the Director of Centre for Housing Policy, which is a little group of 10 or so researchers at the University of York. We're your neighbours, and come and talk to us any time. Get in touch. This is how to do it. And we as well, but come and see us. It's easy. I'm going to be talking today about the research perspective on housing, health and well-being. And this might seem a bit odd coming at the end of the day, we've gone well beyond research to talk not only about policy but action. I just thought it might be useful to provide perhaps a sort of longer term perspective or a different perspective. And I hope I'm going to show you some ideas which will be worth proving under. So housing and health in terms of policy and practice are very, very closely linked once you start looking at housing. And in fact, the historic mission of housing intervention by central by local agencies and by active citizens started off with concerns about health and well-being. So in a way we've come full circle, a whole century after, or more than a century after that, to be thinking about the issues again. And the historic mission was really starting off thinking about communicable diseases, things that perhaps are less significant nowadays, but are still important, and the broader aspects of health and well-being. So developing human capital, thinking about the workforce of the future, thinking about young children, their development, and what housing might do to help or hinder them on that note. There's also been a broader interest in quality of life. So why can't housing be pleasant and happiness and well-being generating in its own right, quite regardless of what it does in an instrumental way for health or for the economy and so on. And then there's a sort of slightly more sinister version of this, which is about prevention of disorder and social health in that sense. When things get too difficult in housing, those people get arrested. And there are moments throughout the whole history of housing policy where that has been an important issue for policymakers. So there's nothing new to be thinking about housing and health, and health is absolutely fundamental to the reason why some of the great institutions we're familiar with, like the local authority, housing action, housing associations, have developed and become so important in this commission we're doing today. But one question is whether over this sort of past century of activity, the focus in terms of housing, health and well-being has changed or perhaps should change a bit more. So are there new ills that we need to think about? Certainly cholera has been successfully defeated, and that is partly due to people like you and the people who came before you working in housing organisations and housing action. But there may be some new physical and particularly social ills, and by moving from thinking about health more narrowly to thinking about well-being, we need to take some of those on. So there are questions about housing and mental health, housing and well-being that haven't been so looked at. They're tricky to understand, tricky to work on, but very important. And there are also questions about the physical and mental health effects of some sort of new housing policy issues. Not necessarily to do with absolute standards, but to do with relative standards. So all-party housing value and social inequalities, which many researchers believe are contributing themselves to both mental health ills, but also physical health ills. So if you look at the work of the authors of the Spirit Level based at the University of York here, Kate Mitchell and Richard Wilkinson, they argue that inequality is damaging itself. Housing is clearly a big engine of inequality in wealth and living standards. So there are really tricky things though when it comes to researching the relationship between health and well-being and housing. And the first thing of all, if we're looking at research evidence on what causes good health or causes bad health, it's extremely tricky stuff. And I just wanted to introduce you to a few studies that you probably won't have come across because they're extremely obscure. You might have come across the idea of the Glasgow effect or the Scottish effect. So the Scots die younger than another citizen of the UK. And Scots die younger even when you take account of deprivation. Glaswegians die younger even when you compare them to residents of cities in England which are same with deprivation levels, for example Liverpool and Manchester. And some public health scientists from Scotland have tried to look into this, and they found 17 different pathways to explain the Glasgow effect. So it's really complicated. There's a real agenda there in trying to track through evidence in each of those cases. And it's very hard to come up with anything clear and simple and immediate advice for people in public policy. I'm actually taking part with colleagues in a project looking at one of these 17 pathways for NHS Scotland at the moment. The pathways include things like Scots drinking more than other people in the UK, and Glaswegians drinking more than people in Liverpool and Manchester, but a whole range of other much less stereotypical issues, including the degree of sunshine that people experience, and the nature of deindustrialisation. In fact, there's a whole school of thought to explain the Glasgow effect by some anti-Scottish feeling on the part of the Conservative Party in the 1980s, and that's the Thatcher version of the Glasgow effect. But the pathway we're looking at is housing and neighbourhood characteristics, to try and understand if there's something different about Scottish housing compared to English and Glaswegian compared to Liverpudlian and Mancunian, and to see if that's driven the difference. So we're sort of partway down that journey. And one issue that I think is worth raising as a researcher is, maybe a mea culpa here. Perhaps it's difficult to make sense of the links between housing and health because researchers haven't been doing what they should have done. And this is a rather shocking study here from the Cochrane collaboration. Their job is to go around and scoop up really good research evidence from all over the world. So they specialise in systematic reviews of evidence on health to try and make sense of these endless studies we read about new things are going to kill you if you're not careful, or taking, whether it's pomegranate juice or eating celery or reading the Daily Mail or whatever it is. These things can easily kill. But anyway, their job is to do systematic reviews. And a rather miserable making study for me and other housing researchers, they said last year, after studying 100 years of research that covered housing and health, they really only came up with a handful of studies that met the gold standard that medics are used to, which is the randomised control trial. So medics like to give medicine to some people and not others, and not tell anybody what's going on, and then measure the results without anyone who's involved in the experiment knowing. And you can imagine that in housing, thinking about housing interventions, it's pretty tricky to do that sort of thing. There are real ethical issues, and the job is to provide everyone with the best you can within the resources you can, not doing randomising on whether people get new accommodation or improvements or so on. But Thompson and others say really it's not a great evidence base to go on. So we've had 100 years of attempts to improve housing, build new housing, and yet we can't be sure what contribution this has made to improved health over that same time period, because we haven't got this really sort of crunchy type of evidence that medics and scientists look for. So that's a bit disillusioning. And it's a huge issue in public policy, I think, because more and more we need to prove the value of every pound that's spent and every hour that's spent in order to justify it and try and get more back. And there's an emerging science of how to do this, but the last century of action has slightly gone to waste in terms of producing that evidence base. But another issue is that not only is it very hard to understand health, but housing is perhaps a particularly complex factor amongst those 17 pathways. So to use a kind of medics language, housing probably has distant but not proximate effects. So sort of long chains of effects from your housing condition to housing circumstances through to eventually a good or worse health and well-being outcome. Effects may be long term. So certainly in the NHS study, we're looking at the housing conditions that people experienced some time ago in order to understand people dying younger now in their 50s, 60s and early 70s. So, what was going on in Glasgow housing in the 50s, the 60s, and probably had those effects. And there's this question about whether housing is having physical effects on people, or is it much more about mental health and those sort of pathways? And then which way of housing? Is it the things that housing policy started off thinking about, overcrowding, physical conditions, or is it about how much people enjoy their housing, or how they are able to use it? So there's, it's about neighbourhoods, so housing is not a clear-cut issue. There's lots of things you might be interested in. I just wanted to take you back to another study here. Why am I talking about this evidence from the 1930s? Well, there's not one McGonagall, the famous Scottish poet you might have come across. In fact, this study is one that made it through the Cochrane Review, and the 21st century researchers thought this was a pretty decent study. And McGonagall and Kirby were health researchers who did some work in the North East, which they published as Policy in Public Health. And they told a very shocking story about the long chain of events following attempts to improve housing in the Middlesbrough area. So, the local authority back then in the 30s was building council housing. It built some nice new combination, lots of thought about design standards, location and so on. Nice suburban stuff. It looked very attractive. It's still there now, most of it. But what they found was that it was a very special aspect of housing that was a key thing for the health outcomes in this situation. Obviously, in their study, they hoped nice new housing, clean and spacious, producing better health. What they found was that this housing actually killed. So the new housing cost more for people in rent and travel. They had less money left to spend on everything else. At that time, most family budgets went on food and housing and much else. The result was worse nutrition, particularly in large families, and increased infant mortality. So this attempt to improve the situation actually worked out to the detriment of the children that they've been trying to help with. And that just shows there's a very long complex chain between housing and health outcomes. And also there might not be the aspect of housing you expect that's key. So here it wasn't the housing quality, which was great, it's the housing cost and the knock-on effects that has for people living in that area. And we need to be thinking about housing costs today as a health issue. Housing conditions remain important, but housing costs have definitely come up the agenda. They're very important. They may be much more important in many cases. So I've done mea culpa as a researcher. I do want to just go back on that and say that even the most stringent of the people who study the links between housing and health, Thomas and Eckhout, who I mentioned, they say that the links between poor housing and poor health are well established. We don't need to have any doubts there. This isn't an area where we let in doubters like climate change or something. And the Marmot Review, very established assessment of housing and health inequality research. The Marmot said that poor housing, quality housing contributes to health inequality in various different groups. So the picture is clear, but exactly which bits of housing we need to focus on, that's slightly less clear. And we need to be very alert to some of the issues that aren't about basic conditions. So what we do know, this is a really good study by a lot of housing people summarising what the impacts of different bits of housing are for health. So overcrowding is one of the first housing issues that promoted policy and concern about health. And you can see that different aspects of housing conditions and so on lead to different problems. And if you're interested in why Scots die young, you need to think about different parts of the housing system, different aspects of housing. But where we're getting less good is down toward the end of the list, where it's these less measurable things. So the unpopularity of housing, stigmatisation of neighbourhoods is implicated in poor mental health. These are tricky things to measure, they're tricky things to change, and they're not always the traditional core aspects of housing policy or core aspects of budgets available for housing policy. So this is about getting onto some of the new social ills and whether we fully understand and doing enough about the impact that housing has on those sorts of problems. well. I just wanted to introduce you now to some people who can help me out here, well, not people, it's little pigs. If you look at the history of public health is about prevention. So even if you are a climate change denier and a housing denier in terms of health, there's a real strong argument for precautionary principle and making sure that families like little pigs have really secure housing. And I can also recruit here maybe a more elevated source of argument. So Nye Beckman, who was Minister for Health as well as being Minister for Housing, said you should make your house the base for your adventures, not an adventure in itself. So don't have a risky situation where there's a real health risk from getting your house blown down by a wolf. What public health should do, what public policy should do, is make sure that people have basic security in all senses, and that really fits with the public health. And I just want to say a little bit about what policy has done and what our predecessors have done for us. And what have the Romans done for us? More important question, what have early housing officers done for us? And they've done a lot for all of us. So public policy and the private sector working together over the last century have made drastic improvements in basic housing conditions. So we know that overcrowding is dangerous to health, but overcrowding, people living in more than one person per room, is a situation faced by half the population of England and Wales in 1911, so back in sort of Downton Abbey days as it were, and it's down to very, very low percents, although you can see that it's not got down to zero, and it's sort of slowed down in the change in the last few decades. So this is a great achievement for everybody, and it's very important that we've eliminated, virtually eliminated, large-scale overcrowding and the health dangers that brings. But there are other interesting arguments you can make, really, about what's going on in policy in a more complex way. So my colleague Jonathan Bradshaw, who specialises in well-being and children, has argued that if you look at the whole of Britain's welfare system, there are some bits where the welfare system is stronger than others. And if you compare the UK to other European countries, there are really quite a lot of problems with the British welfare state. It's rather meaner than many other countries have been. But he argues that there are specific things about the British housing system that make it a saving grace of our welfare state, and mean that overall the welfare state offers people security and that base for their adventures that I was talking about. So it seems that as the housing system can do much to correct the poverty. We know that poverty and deprivation are the main determinant of health in this country, apart from gender, possibly, in terms of longevity and being living healthy lives. But the housing system can actually do a lot to account for that. And it's some of the other bits of the welfare system and society which are creating problems. And so what Stephen's pointed out is that compared to other countries in Europe, we have pretty large social housing stock, although of course it's changed over time. Housing benefit covers a lot of rent for a lot of people in the population, and is well taken up. And we have statutory support for at least some homeless households. And that is quite a strong safety net in housing terms, which is not shared in other countries in Europe. So housing could be our saving grace. And the result of that is that if you look at the housing conditions of people in poverty and out of poverty, there isn't a big difference in physical conditions. Some of those things we know are very strongly linked to health conditions. That's a real achievement to break that link between housing, poor housing and low income. So I think that's something to be really pleased with, well beyond basic things like the change in overcrowding. And let's have a look. So there's an argument, John Bradshaw's argument, is that this is the UK. It's where all members of society have got houses that are a good base for their adventure. Whether it's the rich piggy, the middling piggy, or the piggy on a low income. But I put a question mark there. Because it's up to you to think. There are things obviously changing that safety net I described, and I should go back to it. changed drastically. It's changing further. There's very little new social housing coming through. The housing benefit safety net is being changed drastically at the moment. Support for homeless households is also changing. So there is a reason to think that these biggies might not all be in such a good position as we go forward and throughout the rest of the 21st century. So although there have been great achievements over the 20th century, we need to recognise them and be quite determined about what they are, and think about whether what we're doing to housing is going to affect at least some of these biggies' health in the future. I'm going to go back to research issues now, just very briefly before finishing. So there are some things we do need to know more about. As I say, the links between housing and health are very well established, and we can quite confidently go forward on them. But we don't know about nearly so much about housing and well-being, and particularly housing and good well-being. And one of the projects I've really enjoyed doing since I've been in York is looking at new housing. And the case study is Hudson. My traditional research pattern is to go around and ask people just how miserable they are and how much they hate their homes, because I've been looking at housing problems. But it's very nice to go and visit a place where people say not only are they satisfied with their housing, but that's not the right word, they're delighted. And that's something we really, let's have more delight in society. That is something we should be aiming at in terms of well-being, not just about trying to protect people from misery and mental health, but to promote happiness and delight amongst all. We do need to know more about the cost benefit or the social impact of housing intervention. So that's about going back over history and trying to do good research in the way that McGonagall and his colleagues did back in the 30s. And there is a real issue about who and what to prioritise. I'm saying let's think about wonderful well-being. There's also the tearing holes in the housing safety net, and there are still people living in overcrowded housing, which we know is very dangerous to your health. So there are all these different possible priorities. Without better evidence, really sort of crunchy evidence, it's very hard to know where to go, and that is a key issue for you because the resources are so tight. At this point, I'm going to stop. Thank you very much.
Thanks very much, Becky. Hope people enjoyed that. Certainly some interesting looks back at the history, and certainly you can see some of those things repeating themselves as you go through. We're running slightly behind time. I'm not going to spend a lot of time now. I was going to go through some of the events that we've had running during the week and what's come out of those. What we'll do is we'll get that put up on the council's website under the housing section, so people can look through to it. And if people want, we can send details out to them. What I would just ask is, can people please fill in the evaluation forms and profile forms and put them in the box. It's important that we get that. We want to understand what you've got out of it. Not only today, but in any of the events during the week, so that we can build on that and make sure future events again meet people's individual and collective needs. That's all from me. I just go back to Tracy, who I just want to say thank you. And
I'd just like to say thank you everyone for attending today and attending other events during the week. I've spent the last few days going around building sites. I'm meant to be going up to the Our Lady site this afternoon. I'm not quite sure what condition that site's going to be in with the weather that's out there, so I may be coming around in London in the next couple of hours. I just want to pick up on one thing that Rebecca said. I think it's important that we do understand the experience of people living in homes, particularly new homes. The council's learned from our development of Millwall Drive last year, and I have suggested with the new projects at the White Swan, which is city centre living, and the Betford Lane development, that we go back to those people in 6 months or a year after they've been in there and say, what's good about this? What have we done wrong? What could we do better? Because if we don't keep asking those questions, we won't be making sure that we get Hudson right for the future. So thank you very much for coming. As Steve said, please fill in the forms. We want to know what's been good, what's been bad, what we could do better, what ideas you think we might have for the future, and that helps us plan next year's conference. So thank you.